Welcome to Disrupted Science, the occasional conversation between the authors of the upcoming book, How the Internet Disrupted Science, now available for pre-order. I'm Joy Moore here with my co-author Kent Anderson, and today is Wednesday, November 26, 2025. Hey, Kent.
Hey, Joy. How are you?
You know, I'm going to be honest. I got in a grumpy mood this morning.
Oh, boy.
Well, just
What set you off?
reading all the nonsense that's happening. It just, it just kind of builds up. I mean, you let off a little steam with your post this morning.
I did. I did. Yeah, in case you're wondering which post she's referring to, we're recording this on Thursday, November 20th, and I had to go off on the CDC embracing the autism vaccine lie, and also bringing Andrew Wakefield back to life in their fold, which is disgusting on so many levels. And just, I just remember being in the middle of this at the American Academy of Pediatrics when it started, and how technology was so central to the enduring, the lasting impression that stupid paper made.
Yeah.
Because search engines are preservation engines. They keep things alive longer than they actually should be kept alive. And so, the last, few years, I've just been reflecting on how much stagnation there is in our thinking. And I think part of it is that we're tethered to these engines that are always looking back and pulling things up for us and keeping us stuck. I mean, I just remember when life used to change faster and you could forget the past, and now the past is always with us, and it's kind of sucks.
Right. And
especially when it's stupid and bad, like Wakefield's version.
Well, and on that search engine theme, one of the other things that made me really grumpy is that instead of going straight to the Google graveyard, Google Scholar added some AI crap on top of their already terrible search results.
Yeah,
And
because they could, and they don't care.
Right. And so, which is just adding another layer of junk on top of an already mishmashed, indexed bunch of junk.
Yeah. So we're grumpy today, but we had a great interview.
I was going to say the antidote to my grumpiness was our discussion with Derek about a lot of things, but especially putting things into perspective and talking about some non-scientific publishing types of things, and just getting his calm, overview of things just kind of reminded me this too shall pass.
Yeah, I mean, I think he's in the midst of it. He writes about this all the time. His blog is fantastic to read. And his voice, and we talk a little bit about, his writing voice, and I've always returned to that to kind of recenter myself by finding a voice that I really like to read and would love to emulate as best I can, but usually I pop off too much and I can't do that. So, but he pops off every now and then too, because he gets, frustrated by some of the things that are going on. But definitely, an excellent scientist, a careful thinker, a big thinker, even though, and he's the best kind. He's the big thinker, super intelligent, very experienced, but also just kind of down to earth and not making a big deal out of it. He's just kind of, it's like, yeah, this is what I do. And then we get to talk about astronomy and pies and other food treats, and it's a great little interview. So we want to thank him for indulging us in that. And this is going up right before Thanksgiving, so pay attention to the recipe.
And I was going to say, Derek offered some food for thought for our Thanksgiving episode.
Well, if that clunker doesn't cheer you up, Joy, I don't know what will. All right, without further ado, here's our interview with Derek Lowe. Derek Lowe is a medicinal chemist working on drug discovery. He's been writing a blog called In the Pipeline since 2002. In 2015, I met Derek over lobster rolls to lure him and his blog to AAAS Science, where it has been ever since. Derek tackles a mixture of scientific updates, political perspectives, and critiques of scientific publishing, all in an extremely down-to-earth and readable manner. It's one of my favorite blogs to this day. He's also the author of a 2016 book, The Chemistry Book From Gunpowder to Graphene, 250 Milestones in the History of Chemistry. He's also a very good cook, from what I hear. So welcome, Derek.
Well, thanks for having me.
Welcome. Great to meet you.
Yeah.
So I wanted to talk as a blogger to blogger kind of thing. So how did you get started within the pipeline? And I'm particularly interested in your experience, because my experience has always been finding the voice is what kind of lets the words flow. And did you have any trouble finding the voice initially, or did it just come naturally? I'm just curious.
Yeah, that's a good question. I mean, the blog is pretty darn old by internet standards, because I started reading some of the early blogs in 2001, and I got to thinking, I'd like to do this because I've always been very quick at putting together presentations and papers and the like. So I thought, none of this is exactly a rate limiting step in drug discovery, my real job. So if I do have some abilities in these areas, I should try to get more out of them. So I started the blog and wondered at first, what should I talk about? So if you go back and look at the very earliest days of it, which are archived on Blogspot and in the Wayback Machine, you can find that, I talked about some science and some a little bit more current events, but everyone talks about that. Mm-hmm. I realized, though, when people asked me what I did for a living and I told them about drug discovery, they were like, that's interesting. I didn't know anyone did that. So I thought, that's the signal. That's the topic I should talk about, because hardly anyone seems to know about it and people seem interested. So problem is, I thought I'd run out of material pretty quickly, which shows you that I did not really know what I was getting myself into.
Yeah.
But as far as the voice, when I go back and look at the early stuff, no, it pretty much sounds like it does now. I think I guess over the years, even up till that point, I'd cultivated a pretty idiosyncratic mode of expression, and it, like a good thick New York accent, it has stuck through thick and thin. You can't get rid of it.
You can't shake it. Well, it just proves that it's genuine, which is, I think, great too. So it's not something you're slapping on top of your thinking, but it's how writing is thinking to me, and so it sounds like it's tied together for you too.
Oh yeah, yeah. That's the thing. I sit down and write as if I were speaking, and I speak as if I were writing. Mm-hmm. And it's tough for me to imagine pulling those apart, but I know there are people who do. Vladimir Nabokov once said, I think the way he phrased it was, I write like a prize-winning novelist, and I speak like a small child.
I love it. Do you ever, when you start a post, do you ever end up in a place where you didn't expect?
Sometimes, yeah. Sometimes. And then I actually go back and decide, the front of this needs to be rewritten because, I ended up in another spot. And sometimes I'll split that original idea off into another post.
Right.
And say, okay, this deserves its own space.
Yeah. Mm-hmm. Yeah. I love it. So the government's back in business.
Aha.
Yeah, isn't that great?
Yes.
And now we have a new onslaught of misinformation facing us as various things are coming out, because apparently they were holding things back on their hard drives. The CDC just came out with, perpetuating the Wakefield fraud again, and we've got, something with LGBTQ,
everything
controversy. So all of these hobby horses that they just can't let go because they have this whole narrative. So,
yeah. And not only did they, bring back the vaccine autism fraud, but, anyone who is into logical thinking realized that they also brought up the old prove a negative thing, because their whole thing was no one has proven that vaccines aren't the cause of autism. Yeah. And you just want to bury your head in your hands.
Yep. Absolutely.
Yeah, it's just so infuriating that they're spending so much time to be so obstructive when we already know what the
Yeah.
decision is? So just get on with it and stop
Oh,
messing around with
yeah.
pretending
Yeah.
to be scientific.
Oh, no.
Right,
This is
right.
like the elections back in the old Soviet Union. There's only one candidate,
Yeah.
but the sacred
Have to go through
principles
the
of
motions.
democracy have to be respected.
Hmm.
Right. Well, the old Soviet Union, I mean, let's talk about Putin and all of
Oh,
that. I
yeah,
mean,
yeah.
yeah, yeah, yeah. Prime minister, then president, then prime. Yeah,
Yeah, exactly. They've
yeah,
been gradually dispensing with some of those fictions.
yeah,
Yeah.
exactly.
Do
So
you
you
have
came up,
any?
oh, go ahead,
Go
Joy.
ahead.
I was going to say while we're on the topic of the government, do you have any thoughts on it's hard to follow the FDA approvals processes
Yeah,
now. It just seems to be all over the place, and there are
it
reasons
does.
for fast tracking some approvals and blocking some others. Is what's your take on that,
Yeah,
if you have
I'm
one?
I'm similarly puzzled. I mean, I was puzzled by FDA decisions even before the Trump era sometimes. I've written about the weird history of Sarepta Therapeutics getting things turned down, and then actually, we were going to approve that, so forget that, it's okay. So there have been decisions like that. I did not like both decisions to approve the anti-amyloid antibodies. In each of these cases, the common theme has been inability to prove efficacy, in my
Hmm.
mind, and a lack of balancing it with the risk. And that is, of course, the FDA's whole regulatory job is to weigh those two things.
Right.
Now, I just have no idea of where things are coming from. And it doesn't surprise me. I mean, look at the leadership in here, look at the number of people who've been forced out. The fact that it's chaotic is no illusion.
Hmm.
Hmm.
And it's almost by design. I mean, now they have what, 20 some positions posted to be filled by tomorrow.
Oh,
I think
yeah,
we're
that
recording
business
this on the
stuff.
20th of November, and the date was the
Yeah,
21st, as I
yeah,
recall.
Hmm.
yeah. So it's just
And no
designed just to,
process around that. We talked with Jeremy Berg about that, and
oh boy,
he's
Jeremy Berg
befuddled.
must be having an awful time of it.
Yeah, he seems to be holding up okay, but
Good.
I guess there's something else I have to look at after this. But yeah, there's a
Yeah.
lot going on. But one of the things that you came up with one of my favorite ways to describe the kind of people who have been suddenly elevated into powerful roles in science: idiotic, quick take artist.
Yeah.
So these people seem to be very effective these days, though.
Hmm.
And what do you think it makes them so effective?
Yeah. I mean, you can talk about the general decline in, I guess, expertise, or actually, it's more like the general decline in valuing
Hmm.
expertise.
Hmm.
And that throws the landscape wide open for people like this. You've seen that famous New Yorker cartoon where the guy's getting up in the middle of a passenger aircraft and says, I'm tired of these pilots lording over all of us regular folks. Who says I should fly the plane? Come on.
That's right.
And that's really what we're seeing. It's like, I'm tired of these elites trying to tell me what to do and all this stuff that they quote, quote, know about. So it really leaves a wide open field. And therefore, the people who can speak the most glibly about things that their constituencies want to hear will ascend quickly.
Hmm.
Hmm.
And they get amplified by
Oh, yeah.
by an attention economy. I was thinking earlier today that we've seen a lot of trends in scientific communication where the attention economy has an outsized influence on what gets even
Hmm.
what publishers support. And I was thinking
Yeah.
it's science is not an attention economy; it's an evidence economy.
It really
And
isn't. And there are so many slow moving, slow developing stories in science.
hmm
And that's where you guys may remember the fellow who used to be senator from Wisconsin, William Proxmire, back in the
hmm
70s, 60s,
yeah,
70s. And his big deal was he'd have these press conferences with what he called the Golden Fleece Awards. He would pick some research project that had a funny sounding name and he would
Hmm.
make fun of it for getting funded. And I have to say, I believe in his last years, he actually expressed some regret for that process. I hope he did because he should have.
Hmm.
But that is the quick take artist in its nascent form. It's like,
mm,
can you believe it? But as you guys know, there are a lot of really important scientific topics that come on very slowly and from unexpected directions.
Hmm.
So look at RNA interference. You could have had can you believe we're giving money to people to figure out why petunia flowers have funny colors?
Hmm.
Well, we
Mm,
did. And that's where RNA interference was discovered. You never know. And I think that there's a certain sort of person or a certain sort of personality that finds that intolerable.
hmm
Right, right.
And and cutting the NIH cutting funding for a lot of basic research,
Right.
on one hand, it's to punish the academic
Sure.
institutions through which these funds flow. That's, but it's also to appeal to the public, saying we're not wasting your taxpayers finding out what color petunias should be.
Exactly.
But what does that do then to the drug development
Mm,
pipeline? And how does that
yeah.
connect to the work that you do?
It connects, but again, in a slow moving manner. And that's the dangerous part because I used to say some years ago that, when we were having these big arguments about drug pricing, I said, if they somehow declared pharmaceutical and biomedical research to be totally illegal, let's just stop all of it right now. Pharmaceutically, no one would notice for a few years because it
Mm,
takes that long for
Hmm.
things to gradually work their way through preclinical, through phase one, phase two, phase three, regulatory approval, finally getting on the market. You would have several years of lag before you noticed. And even at that point, it might take people a little while longer to say, you know what? There haven't been any new medicines in a little while. Huh. I wonder
Hmm.
why.
Hmm.
And that is the danger here because, I mean, scientifically, that basic research is really down there in the engine room. And more immediately, which we'll feel sooner, this is the source of all the people we hire in this industry. They're
mm.
graduate students and postdocs and people who had NIH money.
Hmm. Yeah. So the workforce implications come faster.
They come faster, and then scientific implications are even bigger and they come on more slowly, and they'll be a lot harder to undo.
Hmm.
Hmm.
Yep. Yep.
And there's a lot of stock being put in the power of using AI to
Mm,
accelerate drug discovery,
yeah.
kind of like let's automate things based on what we already know. How's
Yeah.
that working?
Yeah, the AI stuff, there's a whole spectrum of AI believers. It's kind of like the old efficient markets hypothesis in finance. You ended up with a strong efficient markets hypothesis and a weak one. The real strong AI hypothesis, which you hear various lunatics espousing, is we don't need to fund any of this research because we're going to have artificial general intelligence next week or a couple of months from now, and it's just going to discover all that stuff anyway. Sit back, open a cold one, watch it work. And I think that's insane. But the weaker AI hypotheses are still kind of problematic because I think that there's a conservation law in effect, AI and ML. And most of the time when people say AI, they're talking about machine learning, in my view. But
Hmm.
these things can be extremely useful in organizing and collating knowledge you already have. That's what AlphaFold did. It
Hmm.
organized and collated the knowledge that was implicit in the gigantic number of protein data bank structures. But these things do not create knowledge. They can't. That's
Right.
not what they do.
Right.
Hmm.
So they organize what you already collected. We haven't collected enough stuff in biomedicine. Nowhere near. No, I mean, someone from NVIDIA was trying to tell me not too long ago about their virtual cell that's coming on
Mm.
real soon now. They're going to have all these cellular processes modeled. Oh, you're going to be able to do all kinds of stuff. And I tried to be kind because we don't know what's going on in the cell. We find stuff every year that's like, dang, look at that. I wonder what the
Right.
hell that is.
Right.
That's not in your virtual cell model. 10 years from now, people will be looking at all of us and saying, oh, those poor people, they didn't know about X and Y and Z. No wonder they weren't getting anywhere.
Right.
Well, that's right. I mean, that's why there's more basic research being published every day. That's exactly what they're doing. They're
Yeah.
still learning.
Yeah. Of course, we're trying to put a stop to that. So we're,
Right.
Yeah, we don't
clear
want to
that
figure
over.
out the world.
But that's the problem. I mean, the ability of current AI systems to help out in drug discovery is almost perfectly inversely proportional to the cost and importance of the problems. They can help you out in very early stage stuff, like throw me out a bunch of plausible molecules based on the ones we've already made. You know, dig
Mhm.
through the literature. And we're getting to this point. Dig through through the literature and find me some good ways to make these I might not have thought of. Okay, fine. But the big problem is we have an 85% clinical failure rate in this business. It's the central fact of the drug industry. Everything that's weird or irritating or inexplicable about pharmaceutical industry comes down to that 85% failure rate. No other
Right.
industry does that. Those are due to picking the wrong target or getting weird talks. And AI
Mhm.
can't help you out with either of those yet.
Right.
Right.
Yeah.
Yeah, it could help, speed along some things for an assistant, and but it's not
Yeah.
gonna ask new questions.
Yeah. And as long as we have that 85% failure rate, the way I put it is it will just get you up to the wood chipper a little faster.
So you're working in industry,
Right.
which may be a relief these days because academia is
Yeah.
under
Yeah.
assault. So how are your colleagues in academic research doing these days?
Oh, it's rough. I mean, academia academia has, for its reputation is once you get tenure, whoo, everything's made, but it's always been a rough way to earn a living. And I've always known that when I talk to friends or colleagues or even new acquaintances in academia, the constant topic is just ask how the funding's going. It's like
Hmm.
asking a farmer about rain. It's
Hmm.
it's always there and it's never what it should be. But now it's just a completely awful new era. And I think people are still trying to get their heads around it and trying to figure out it's the same chaos that the FDA has been the chaos in scientific funding. What the hell is going on? No, I have a tremendous amount of sympathy for these people, especially younger career folks who
Mhm.
got started before this happened and now find themselves thrown into this mess.
Yeah.
And and part of what you cover in your blog, you read a lot of papers,
Mhm.
which is a great service. There's a lot that's being, no, seriously. I mean, there's a lot of hype being made about, plain language summaries and things like that. And then
Mm.
there used to be researchblogging.org, where it was
Oh,
a
yeah.
network of bloggers,
Right.
scientists talking about other people's scientific papers. So what have you found that the types or the quality or
Mm.
how has the literature that you've been reading changed over the course of the years that you've been doing your blog, or has it?
Overall, it's pretty similar. There has been a rise in truly god awful papers, but they tend to get published in truly god awful journals that I just don't read. So I have a big RSS feed with a lot of journals on it, and they cover things that are of interest both for the blog and for my work, because those overlap quite a bit, although I certainly don't talk about anything I'm actually working on. It's been a great help to me because I've kept up with the literature so much more thoroughly than I ever would have on my own. I don't kid myself. I just have no doubt about that at all. It's really forced me to read more widely and more thoroughly.
Hmm.
But the literature itself, I mean, there are problems out there. There's a lot of AI generated content that editors tell me are flooding into the journals, especially as so called review articles. There
Hmm.
are endless permutations of scams for authorship, for reviewers, for citations, everything you could name. That stuff is just going to get worse if you don't do anything about it. Fortunately, people are trying to do something about it, but it's not going to be easy. I'm particularly worried about AI image generation to fake up photomicrographs and Western blots and all those things that have been problematic in the past. You're going to be able to make them so nice that even the sharpest eyed people aren't going to be able to tell it's a fake.
Yeah.
Hmm.
Yeah. So impact measures were especially confusing this year. and you wrote a really good analysis of how divergent the rankings were compared to what chemists actually see and do. Can you walk us through that a little bit?
Yeah. This is, people have had the various journal impact factors for quite a while, and the publishers just love them to death, especially when their number goes up.
Right.
But
And
when they don't, they say, don't pay attention to that. Look at
exactly.
your alt
Right.
metric.
No, it's just some number. Don't to pay no attention. Oh, for sure. And the blog post I wrote was an attempt to come up with yet another ranking of journal impact. And what struck me was the ones in my fields of organic chemistry, medicinal chemistry, chemical biology made no sense to me at all. There were journals on there I have never, ever read a paper from. And obviously, the stuff is just being gamed. And that's the problem with all of these metrics. The old saying in business has been, if anything that can be measured will be managed.
Mhm.
Well,
Right.
anything that can be, I guess, expressed numerically will be gamed
Hmm.
if you can possibly do it. And that's all this was a bunch of, I don't know how they did it. I don't know if they had some sort of self-citation thing going on or
Oh,
deliberately taking papers that had
I have
monstrous reference lists or whatever, but it
I
was
have
just
I have a few theories,
ah,
Yeah, there's a lot. It's the self fulfilling prophecy of open access,
hmm,
in that papers that are open are more likely to get cited, and now
hmm,
you add in machine processing of the literature, and they're going to grab the more open ones that are
right.
going to fit their criteria before they are going to have to deal with going through paywalls and things like that.
Hmm.
So the people who are using automation to write these review papers are sourcing from the same pool of
Ah,
open stuff.
yeah, that makes
And so
sense.
that's how you can see a lot of impact factor rankings have really been skewed within fields with journals that just you wouldn't have heard of before.
Right. Oh,
It's
that
just
makes a lot of
math.
sense. Yeah.
Yeah. Math and incentives, right? Because the other thing is that when Altmetric came out and was measuring things like mentions in on Twitter and mentions on
Hmm.
other media sources, that all of a sudden all the publishers found that they needed a social media manager to
Yes.
push their articles out on Twitter because there was
Hmm.
now an incentive to do it and it was being measured in a way that they could brag about. So it becomes
Yeah.
this circular kind of self-reinforcing
Yeah.
game.
I mean, it's a never-ending battle as long as the incentives are there. If you provide incentives, people will take advantage of them. And the incentive in so many places and so many institutions and countries is publish, publish, and publish in
Mhm.
the best journals you have, and we'll find some way to pick the best. Oh, here's a list. Goody.
Yeah.
Yeah, right. So I'm going to shift topics a little bit. So you are a serious amateur astronomer, and I would like a rig tour, and I would like to know a little bit more about how you do it, when you do it. Is
Sure.
winter really the best time of year to do it?
Oh boy. Yeah. I
Lots of
mean,
I have lots of questions. I have lots of questions. We might
honestly,
have to
I
take this
think
offline.
yeah, I'll do a little bit of that. Yeah, no, that is kind of my weekend hobby or vacation time hobby, and
Hmm.
it's just dodging the moon. Half the month is shot. Too much moonlight.
Yeah.
But I have an 18-inch Dobsonian reflector. I don't do any imaging, so my part of the hobby. A lot of people who do it fear it's becoming increasingly antiquated because the imaging has gotten so good and people do more and more and more of it. I might get into that after I retire. I might not. I enjoy looking at the stuff directly with my eyes. I'm
Hmm.
going to be setting an alarm clock sometime in the next week or so to get up at like 3 in the morning, set the telescope up the night before, get up at 3 in the morning and go see this interstellar comet that's coming through the system because I want to see it
What
with
day?
my
What day? What day?
own eyes. It's the only time that this thing's ever going to be here.
What day is
So
it?
I like that
I need
part.
I need a date. I need a date, Derek.
It's going to be visible all the way to the end of the year. It's
Okay.
in the early morning before sunrise, and it's getting higher in the sky every week, but also getting gradually dimmer. So you're going to need a bigger and bigger
Better get there
telescope. So you
soon. Okay.
got to pick your spot.
All
But I
right. I'll look
enjoy
it up.
looking at this stuff. I like looking at things that, I mean, I had a telescope, a small one, when I was a kid, 9 years old in Arkansas. And going back and seeing those objects, it's like visiting old friends. Only
Mm.
these actually don't get older. They stay the same up there in the sky, at least to human eyes.
Yeah.
Mm.
So it's kind of reassuring in a way.
Right. Yeah, I actually for the first I've looked at Saturn forever. That's
Oh,
kind of
yeah,
my go-to, of course, because it's
sure.
gorgeous and
Who doesn't?
always puts on a show, right? And for the first time this year I saw it edge on. I'd never seen it
Yeah,
edge on, and that was like, "Oh,
it's really
that's
weird, isn't it?
it is weird." Yeah, but it's
Yeah.
really cool.
I got up at 3 in the morning back in October to see Titan, Saturn's largest moon, cast a shadow down on the Saturnian clouds.
Wow.
That happens during these edge on periods for a series. It
Yeah.
happens like once a month for about 8 months in a row. And I
Wow.
managed to catch one of them. And I was like, yep, good. Because it's going to happen in another, I guess, 20 years or so. And who knows? I want to see this now.
Yeah, yeah, yeah. That's amazing. Does it still give you the kind of chill and thrill that it did initially?
It does. It
Yeah.
really does. That's one of the
That's so
things I
cool.
like about it. It
Yeah.
is. I mean, some of these things I look at are not very impressive to the eye. Some time back, I was looking at a quasar in constellation Virgo, and it looks like a little bitty, tiny, white, fuzzy dot that you can just barely see. But looking at it, I realized that these photons that were hitting my eyeballs right then left 3 billion years ago, before our
Hmm.
solar system even existed.
Hmm.
And here I was looking at
Catching
them
them.
right there. So I
Yeah.
enjoyed that.
Yeah. 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 Yeah, there's nothing like it. My in-laws, I had the pleasure of, they never looked through a telescope till they were in
Oh,
their 70s. And we set one up in our
oh,
backyard and they looked through it and it just changed them. They were just,
oh, that's
because
great.
we're like real time looking at Saturn and Jupiter and their moons and the wobble, the
Yeah.
atmospheric wobble that you get and just the
Hmm, hmm.
sense of it's really happening.
Yeah.
And yeah, it was profoundly great.
I
So,
love showing people Jupiter's moons. I tell them, this is what Galileo saw. And then when he came back the next night and looked at them again and saw them going around Jupiter, he knew he was in big trouble.
he had a different chill go down his spine.
Yeah, like, okay.
Yeah.
Well, I don't know anything about astronomy, but I do know a little bit about cooking.
Hey, hey.
So that's something that you're also pretty famous for. And this is our Thanksgiving episode.
All right.
And Kent told me to make sure that we don't end this discussion before we find out about your chocolate pecan pie.
Oh, yeah, that's coming up.
And then let me check. Did I say is it pecan or pecan?
Depends on where you grew up. Where I
Well,
grew up, it's
this is
pecan.
your pie, so
Yeah,
it's a
pecan
pecan.
is how I
Okay.
say it. The one that I avoid is pecan, and
Yeah.
that is another
Yeah.
one. That sounds like something you'd keep under a bed in a farmhouse. But I
Gotcha.
Or if you're an Amazon driver.
yeah, exactly. So no, that I've made that. That's a modification of an old New York Times Craig Claiborne recipe, and it is absolutely reliable. I've made it for years and years, and love it every time. It's packed with vitamins, probably, but
Yeah.
We'll
it's
say
packed
that
with pecans,
it's a
though.
health food. It's a health
Yeah,
food.
I do add more pecans than the recipe calls for because so many commercial pecan pies are like an inch of glop and about two
Right.
millimeters of pecan on the top of it, and that's just not
Yeah.
right.
Yeah.
So no, I do like cooking, and you should never trust a synthetic organic chemist who can't cook. Some of them don't cook, but if they can't, that's a bad sign.
Now, how would you compare cooking with baking?
Oh, baking's so much harder. I mean, the chocolate pecan pie is pretty easy. It's hard to mess that up, although there is a step where you add this hot sugar and chocolate stuff to a bunch of beaten eggs. If you do that too
Mm.
fast, you're going to make chocolate scrambled eggs. You're going to regret it.
Oh,
But overall, baking is much harder. And you really have to stick to the recipe on that until you get your bearings. You can take like a simple cake recipe and just change 6 or 8 different things, the order of addition, all these things, and you'll make 6 or 8 different cakes, by golly.
mm-hmm.
Hmm.
Absolutely. Absolutely. So, and who's there? There's a chemistry, cooking overlap author, isn't there? Who's that guy?
Oh,
McGee?
Harold McGee.
Harold McGee. Yeah. His
Yeah.
book is just always amazing to read. Just, and his whole thing about gluten lattices and,
Oh, yeah. No,
sugars and
McGee's very good on that. I have a table of his from one of his books on the ratio of sugar and fruit juices to make sorbets at home, which is
hmm.
just, I mean, the Bible for that kind of stuff. Lime juice and sugar sorbet made fresh is one of the greatest things in the world.
Mm.
Wow. All right.
You make that and you realize that you've never had anything like it before. And here it is. You just made it in your own kitchen.
This is all of a sudden my favorite podcast episode. I love it. All right. Well, this has been great and I really appreciate it. I think we're going to move on to discoveries of the week if you're ready to do that.
Okay.
If you're ready to do that.
Okay.
So, all right. Now it's time for discoveries of the week. Derek, do you want to kick it off?
Yeah, I've been thinking about this, and my brain has been casting around. Are we talking about scientific discoveries, things you came across in the literature, or because I've
Your
got a list of
choice.
things in all of them.
You can go. You can have two if you want.
Yeah, why don't you do, yeah, because we will talk about things like
Yeah,
animals and food and
Oh yeah.
TV
yeah.
shows.
Oh no, no.
And then we've had
Oh no,
some
because
guests share some really important discoveries with us, and we're happy for both.
yeah, it's a tough call because I'm reading the literature like I do. I'm always coming across new stuff, but I really enjoy it when I come across something that totally changes my thinking about things. And as you get older, it's harder and harder to come across those things. Maybe because you know a lot, and maybe because you get set in your ways. So I'm really happy when I come across stuff that makes me go, huh, look at that. And scientifically, the thing that have been doing it for me are mostly a lot of stuff from like immunology
Hmm.
and the idea that we might be able to fix autoimmune diseases at the root, at this whole autoantigen thing where you're attacking your own tissues. You might really be able to use cell therapy and some other things to reset your body's system to where you no longer have these B cells pumping out antigens that say, hey, go attack the nerves. Come on, do it. You know you want to, that
Right.
kind of thing. And it's just fascinating to me that this could actually work. And at times like this, I'm just so glad I've stayed active in the business long enough to see these things happening.
Yeah.
Hmm.
So that's
That's
my big
exciting.
scientific one.
Yeah, that's great. It's also, it reminds me of more of a mundane thing, but just how they're finding that peanut allergies are going away as the children have been gradually
That's a
exposed to
perfect
them.
example. Yeah.
Yeah.
Hmm.
Yeah. And you have these things that we're going to look back on the same way that we would look back on people getting, I don't know, cholera and saying, oh
Hmm.
my
Hmm.
gosh, cholera, man, the clean water took care of that, didn't it? And it should. And you'll look back maybe eventually and say, oh yeah, those peanut allergies, those must have sucked. A good thing we know how to avoid those.
Yeah,
Yeah.
yeah. Well, the hygiene hypothesis and all of that too. My wife
Yeah.
always lords that over my head because she grew up in farm country, and she's like,
Oh yeah.
"Yeah, yeah, I don't have any allergies. How do you like that?"
I grew up in Arkansas. I still have a little bit of allergy in the spring, but not bad. It really hit me when I moved to New Jersey. I don't know if that says something about New Jersey.
So, Joy, do you have a discovery of the week?
I, well, no, I just want to make sure, Derek, did you have
Did you want to
other?
go do a
Oh no, go
twofer?
ahead. Go
Okay.
for it.
So my discovery of the week is it's goes back a few months. I discovered that this frou-frou grocery store I go to some of the time just to get a certain like cuts of meat and fish because they do a
Okay.
good job. Well, they came out with these frosted pretzels.
All right.
And in the summer, they were key lime flavored and
Hmm.
lemonade flavored and these wonderful fresh, and it's not just like those yogurt covered pretzels that are pretending to be healthy. But then And then I got kind of addicted to having a couple of them, after dinner. And then
I think
they
I see
keep
where we're going.
changing them seasonally. And it was a low point where it was pumpkin
Yes,
spice
yes.
and these horrible flavors that you don't want. And but luckily they're back
Oh,
in a good season now for the Christmas season. So we have salted caramel, and we've got peppermint chocolate.
I'm on board with peppermint chocolate. I'm not a big fan of the pumpkin spice stuff. And
Mm-mm.
this is one where my wife and I are in deep agreement because she hates it even more than I do.
Yeah, there's a rebellion coming. There's a rebellion coming. Absolutely. All right, that's a great one. So mine is also food related. Sorry, but
Excellent.
maybe a little chemical. I don't know. But
Hmm.
so my daughter and her boyfriend went to Chicago to watch friends run the marathon a little while ago, and they
Oh,
came back with these packages of beautiful gold foil packages of cheddar caramel popcorn,
oh, yeah.
which sounds. Um, I
Hmm.
I was hesitant.
Yeah.
Mm.
I was
Now, was
hesitant
it
because I
is
like one and I like them both, but the together was making
Yeah.
me a little bit hesitant.
what color cheddar? Is it
Orange.
orange or white?
Orange,
Orange.
orange. Yeah, yeah.
Hmm.
So it's
Mm.
a strong look and it's a strong cheddar. I mean, it's
Hmm.
getting into it's getting into the
Really
weeds on the
sharp, huh?
cheddars. Yeah, it's deep. And it's like Cheetos cheddar,
Okay.
But
like that kind of dry powdery thing. But anyhow, you put them
Yeah.
together,
how is it?
good. It's good.
It is
Really?
good.
Not a raging fan, but it's like that's pretty good. It's like salty, sweet,
Huh.
typical thing. And it reminds me, I heard they had an episode of a podcast where somebody had said that they liked to put ketchup on their French toast instead of
Oy.
syrup.
Oh, oh,
And so
Oy.
they had who's the guy who played Ron Swanson on Parks and Rec?
Nick
Nick
Offerman.
Offerman. So they had Nick Offerman try it, and
Ooh.
he's a very thoughtful guy, and he said, "Not bad. It makes you realize how much sugar there is in ketchup."
Ah, yeah, he's got a point there.
Yeah,
Well, I guess
but
in
he
your
disagreed
case,
with it because he thinks French toast is just a maple syrup delivery system. So
yeah, yeah, something to that. So you basically came on the side of this wasn't nearly as bad as I thought it was going to be.
yes, yes,
The
that was
cheddar
my
popcorn.
discovery of the week is that
That's
some
your ringing
things.
endorsement. It's not as gross
Yeah,
Yeah,
yeah, I can see that on
I
the
don't
as
think I'm
it.
package.
getting an ad
Not
deal out
as
of that
bad
one.
as I had the reverse happen to me many years ago. It was back in the 80s, and I was back in Tennessee for holidays. My mother handed me a yellow colored jelly bean. She says, "You've got to try this. This is so good." And I put it in my mouth. I thought, lemon. That's what a yellow jelly bean is. No, it was one of those buttered popcorn ones.
Mmm.
Oh,
Yeah,
Jelly
and
belly.
some people
Yeah.
love those things to death. And who
hmm
knows? I might have worked up a taste for them if I hadn't put it in my mouth expecting lemon.
yeah,
Yeah.
right.
Oh boy, no, no, that's 100% the wrong way. If that's
No, I remember when those jelly beans were the rage, and it's like they had the grass one. Did you ever try the
no,
grass one?
no, miss
Oh,
that.
they had terrible flavors. Like, you had like cut
But
grass
did it
was one of
taste
the
like
flavors.
grass?
It tasted like you were eating cut grass.
Well, is that terrible or not? I
It's
mean, it's a
terrible.
perfectly
It,
faithful.
not if you're a cow, you know.
Exactly,
All right,
exactly.
I think we're probably having people having problems with this at this point.
Yeah,
So we'll talk again about chocolate pecan pie. You can find a recipe right on your blog. You publish it
absolutely.
every year. So
Yeah,
Hmm.
just search Derek Lowe chocolate pecan pie and you can't miss.
yeah, so let's end on a sweeter note with that.
Yeah,
That sounds better.
Yeah.
yeah.
So
I'm looking forward to it myself.
all right, thank you, Derek.
Thanks
Thanks.
so much.
Glad to have it.
Thanks for tuning in. Thanks to our friends at Provoke the Truth for the music. And as always, let us know what you think. You can keep up with developments at the Geyser, where you can subscribe to support our efforts on everything that we do. And finally, you can reach us at disruptedscience@gmail.com. We'd love to hear from you.
All right, thanks everybody.
Bye.